Why do people get skin tags? What are skin tags? And are diabetics more likely to get skin tags than other people? On today's episode, you're going to learn all about skin tags and, of course, how to treat a skin tag, including medical and non-medical treatment options for all of you that are watching. Before we get started, this is your host, Diana Bitucci. I'm a board-certified APRN here in the United States. Please consider subscribing to my channel, share this video with others, and always let me know what your thoughts are down below. Skin tags are also known as fibroepithelial polyps. They tend to be small, benign growths that typically occur where skin rubs against skin or clothing. We don't really know the exact mechanism of why skin tags occur, but we have a pretty good idea of what makes you more likely to develop a skin tag. Although skin tags are harmless and benign, they can actually become irritated and cause discomfort for people, and sometimes they can actually catch on clothes, which can become very irritating. So let's talk about the factors that actually contribute and make you more likely to develop skin tags. Number one is going to be friction. Skin tags often develop in areas of body where skin rubs against the skin, such as your neck, your armpit, groin, and under the breasts. Friction and constant irritation can lead to the formation of skin tags. Honestly, a lot of times people do come and complain about skin tags, and they'll complain about exactly where there's folds or where there's a lot of friction going on. For a lot of women, they tend to be around under the bra area because we know that there's constant irritation with the bra and the skin, which can unfortunately lead to skin tag formation. Number two, genetics. I mean, we can't really escape our genetics. We know that if we have family members who've had or have a lot of skin tags, we are more likely to actually develop skin tags ourselves. It's this souvenir that we kind of carry over from family members that we may not necessarily want. We don't really have control over that. Number three is going to be hormonal changes. We know fluctuation in hormone levels, such as during pregnancy, puberty, or in individuals with hormonal imbalances, may actually cause formation of skin tags. And we see this a lot in pregnant women as well. I treat gestational diabetes, so I see a lot of pregnant women on a regular basis. They're always complaining about their skin tags or getting more skin tags, or actually if they have skin tags, they tend to grow a little bit bigger because of the hormonal changes during pregnancy. There's not much that can be done for that either. It's just the way it is during pregnancy, and the hormones tend to be all over the place. This next one is actually completely in your control. Number four is going to be obesity. Being overweight or obese can increase the likelihood of developing skin tags or excess skin folds, which causes creases and provides a perfect environment for skin tags to grow. Therefore, if you are overweight or obese, making sure that you're doing everything you can to lose weight, such as exercising, eating well-balanced meals, you are staying as active as you can, and you're doing everything that you can to try to bring your weight within the target range is going to be a very crucial element to try to prevent skin tags from happening. Number five, we also cannot control age. We know that as we get older, we are more likely to develop skin tags versus people who are younger. So as you age, you might notice that all of a sudden you're waking up and you're noticing new skin tags over your body. Unfortunately, that is a common thing that happens as we get older. We do get wiser, but sometimes we do develop things that we may not necessarily like as we get older. Number six is diabetes. So there's your link. There's a lot of studies that have been done between diabetes and skin tag formation. People with diabetes tend to have a lot of insulin resistance and other metabolic issues going on. So there's a lot of defects internally that are going on with people who have diabetes. As a result, because there's so many hormonal and so many internal defects that are not regulated, causing higher blood sugar levels, causing more insulin production, and so much more, those people tend to develop more skin tags. So a lot of diabetics do complain about skin tags, which is why I see this so commonly in my office on a regular basis. So the key is obviously getting the diabetes under control, managing your blood sugar levels, keeping things under target range so we can prevent new formation and more skin tags from happening. Number seven is HPV. HPV is responsible for some of the genital skin tags that occur. So therefore, obviously, preventing this is going to be crucial. So now let's just say you have a skin tag like I do. What are the possible solutions and what can you do to get rid of it, especially if it's starting to irritate you or causing discomfort? The surgical options to remove skin tags, number one is cauterization or electrocautery, where the professional may use heat or electricity to burn off the skin tag. Number two is cryotherapy, which is liquid nitrogen is applied to freeze the skin tag, causing it to fall off. I kind of like that one. It doesn't sound too invasive. Number three is surgically removing them. They will use a local anesthetic and they will literally cut off the skin tag. And of course, outside of that, there's also over-the-counter medications and devices that people have come up with. And we know that there's also some home remedies that people use, like apple cider vinegar or tying the skin tags for several days until it falls off itself, because we know that, the skin tag won't be getting any oxygenation. You're blocking the oxygenation when you're tying it. For all of these, I always consult my patients and let them know to make sure they're consulting with a dermatologist and just making sure that these remedies are okay before they try them at home. I'm always about, making sure that you're taking the safest route, especially if you're a diabetic and if you have higher blood sugar levels, because we know that you are more prone to infections. And we know that this can turn into something much bigger than just removing a skin tag. So you always want to take the precautions and consult a healthcare professional. I hope you guys enjoyed this video. Please let me know your thoughts down below. I'll see you all on the next video.